New COVID-19 Omicron variant has fueled the fourth wave in the country, with Tshwane being the global epicentre of the variant. That's according to the South African Medical Research Council. Let's discuss this now with the Council's AIDS and TB Research Director, Dr. Fareed Abdullah, who is also part-time HIV clinician at the Steve Biko Academic Hospital. Dr. Abdullah, thank you very much for your time this evening. Let's start off with unpacking why you think Tshwane is the global epicentre and, in fact, the epicentre here in South Africa.
Thanks for having me. The first documented cases of the Omicron variant are from Tshwane, and we've seen an exponential rise in the case numbers, which are sort of linked to the same time as the Omicron virus. I think it's common cause now that the new infections in Gauteng are being driven by the Omicron variant, and Tshwane has had the highest number for the last 3 weeks. Just in the last 5 days, we've had almost 10,000 new infections in the Tshwane district.
Are tests that are being conducted testing specifically for Omicron, or is it just sort of at this stage general assumption that those would be driven by the Omicron variant?
So there's a rather fortuitous situation obtaining here, in that the normal PCR test on most of the PCR testing machine can pick up that this virus is different in one region of the viral genome. And so we're able to more easily say that this is Omicron. The same thing happened with the Alpha variant, which we didn't have much of here. But this S gene drop-off shows not all the hospitals have the same machine, but it's been rather easy to pick up that is Omicron with the normal PCR test. And looking at the lab data behind just the result that you get, which says it's positive.
Given the number of new daily infections, are we at this stage to believe that the Omicron variant is more transmissible, or is it too early at this stage to determine that?
I'm not the expert on this subject, but just from what I've seen, you know, the experts like Professor Shabir Mahdi are pretty clear that there is higher transmissibility. There are enough signs now to show that this is highly transmissible. The best sign is that there have been a few comparisons showing the rapidity with which this variant has spread compared to the previous waves, which were previous variants also. And I think it's pretty common cause now that this has a higher transmissibility than the previous variants.
Dr. Abdullah, what are we seeing in our hospitals at this stage? You're on the ground dealing with cases, seeing what is happening in terms of hospitalizations, increasing or lack of capacity of beds. At this stage, we're not quite at panic stations yet, but all three of the experts we spoke to on a panel discussion on Omicron a little bit earlier this evening said that certainly there is concern, that we need to take heed, that we need to make sure our medical facilities are prepped and ready for the peak of this fourth wave. Tell us what your observations have been in the last couple of days.
Well, the first thing that is undoubted is that there has been a rather rapid rise in hospital admissions with patients who have COVID. They're testing COVID positive, whether they are presenting with COVID pneumonia or severe COVID disease or other conditions, and are incidentally testing positive for COVID, is something that I'll say a word about just now. But the rise in infections is rapid, especially in the Tshwane area, and I believe now in most of the Johannesburg hospitals and Ekurhuleni Hospital. So it's rapid. I mean, we're seeing, 10 to 20 admissions a day at Steve Biko, but I can tell you that the hospital admission numbers, the bed occupancy numbers for COVID beds at George Mukhari has grown substantially over the last couple of weeks. Jubilee Hospital, Kalafong Hospital, so all of the hospitals in Tshwane, in the public sector. In addition to that, all of the private hospitals are seeing an upsurge. And it's a big increase in hospital cases. And the same is being reported now from Barra, from Helen Joseph, and from Tembisa hospitals. So undoubtedly, there's a rapid rise in hospital admissions, and the COVID bed occupancy is increasing, even kind of increasing 30-40% per day over the last few days.
What kind of preparations are being made in hospitals across Gauteng in terms of increased bed capacity, increased staff capacity, increased capacity in terms of ventilators and equipment?
Yeah, so the main thing we've kind of seen now is that hospitals transition from during when waves start to rise and peak and the COVID admissions increases, then there's a shift from the non-COVID areas to the COVID areas. So there's a shift of resources, beds, staff, equipment, and that's because Gauteng has been through previous waves, and the third wave was a whopper. It was a big one. That shift is starting to happen, and you will think this is the fourth time we're doing this now, so the hospitals are responding in that way. But what I would like to talk about is that we're seeing a very different picture in terms of the profile of the patients, and I'm sure you want to come to that now, but let me jump right in. I did a snapshot on Thursday of 42 patients at Steve Biko Tshwane District Hospital, which is one complex. And what struck me is that 76% of the patients in the wards were on room air. They were breathing normally. They didn't have oxygen masks on their faces. And this is quite a big difference from before. So I would say that most of the admissions to COVID wards at the moment are incidental COVID admissions. They are in the hospital for another reason, another very good reason. They're ill from a medical, a surgical condition or an obstetric condition. But the majority are not oxygen dependent and are in the hospital for another reason. There are still a small number of patients, and whether that's rising or not is a little difficult to say, who have the classic COVID pneumonia, but it's rather remarkable. And I've been there in the previous 3 waves, so we've actually seen that there is a difference now. Now, I must immediately say that this could be just an early effect, and that 2 weeks from now, I'll be sitting here saying to you, it's as bad as it was in the previous waves. But for now, there is definitely a difference. And my colleagues in other hospitals are confirming the same picture. So 76% of our patients in the COVID wards at Steve Biko Tshwane District are not oxygen dependent. And a similar picture at Helen Joseph, George Bukhari. Those are the hospitals I've talked to.
Certainly some good news. We do thank you for that, Dr. Fareed Abdullah from the South African Medical Research Council, giving us some good news about those patients who are currently hospitalized, 76% of them not needing to be oxygenated. Hopefully that holds out as the 4th wave peaks in the coming weeks.